minority of thyroid nodules are cancerous, malignant, but determining which nodules are malignant can't be done by symptoms alone. If you have a thyroid nodule, you may see an endocrinologist, a doctor who specializes in diagnosing conditions that affect the endocrine system, its glands, and the hormones they make when assessing a thyroid nodule. Your doctor's main goals are to assess if your thyroid is functioning properly, and also to rule out the possibility of cancer. Thyroid function tests measure blood levels of thyroxine, T4, and triiodothyronine, T3, hormones produced by your thyroid gland. The results indicate whether your thyroid is producing too much thyroxine, hypothyroidism, or too little, hypothyroidism. The tests are simple to perform and just require a small blood sample to be taken. This is done either in your local hospital as an outpatient or by the nurse in your GP surgery. The blood test results are usually available after several days. You may be prescribed an ultrasound. This imaging technique uses high-frequency sound waves to produce images on a screen. It is an excellent method of seeing the shape and location of thyroid nodules. It may be used to assess the structure of the nodule, to determine if multiple nodules are present, and also to evaluate the nearby lymph nodes in case they are swollen. The ultrasound is usually performed as an outpatient by a radiologist or an endocrinologist in a hospital. If your blood test results indicate you have hyperthyroidism, your thyroid hormone levels are too high, your doctor may recommend a type of thyroid scan called a scintigraphy. The thyroid scintigraphy will normally be performed by a specialist radiology nurse or technician. During this test, a small sample of radioactive iodine is injected into a vein in your arm. The endocrine tissue in the thyroid gland absorbs the iodine, which allows it to be seen better on the scanned image. You will be asked to lie on a table while a special camera captures an image of your thyroid gland on a computer screen. Nodules are biopsied to determine whether they are benign, made of cancer cells, malignant, or suspicious. A fine needle aspiration, or FNA, can indicate what type of nodule you have. The FNA may be performed by a radiologist, an endocrinologist, or a surgeon. During the procedure, a very thin, fine needle is inserted into the nodule, and this removes a small sample of the cells there. The procedure may be uncomfortable, but it is not usually too painful. Many people tolerate it without a general anesthetic, but you can ask your doctor for a local anesthetic if you are worried. Many people are afraid of having a needle inserted into their neck, but it is important that you should know that the procedure is straightforward, effective, safe, and carries very few risks. The whole procedure takes about 20 minutes, but the actual time that the needle is in your body is no more than 30 seconds. The needle is usually inserted a few times, usually 3 to 6 times, in order to obtain enough nodule cells for the laboratory to analyze. The sample is then sent to a laboratory and the thyroid nodule cells are examined under a microscope. This is known as cytology. It means the study of cells. Results are normally available within a few days to 2 weeks after the FNA was performed. The results of an FNA are often used by doctors to decide if surgery is necessary to treat the nodule. Unfortunately, certain nodules and types of thyroid cancers can't be diagnosed before surgery, and FNA cytology results are not always 100% conclusive. In these cases, more nodule tissue is needed for an accurate and definitive diagnosis. To do this, the nodule will need to be removed surgically and the whole nodule will be analyzed in the laboratory. You can find more information about the different exams in the section Understand the Diagnostic Process.